Now, people who are not vaccinated. All right. Many are legitimately hesitant, and people need to understand. We have to get information out there and deal with questions as they come. It's not as simple as being uninformed. Even our nation's medical workers are not all fully vaccinated. The people on the front lines of the COVID fight, the people who were given first dibs. In New York State, nearly a quarter of hospital workers have not yet been vaccinated, and around 40% of U.S. nursing home workers are unvaccinated. This week, a group of nearly 60 major medical organizations issued a call for vaccine mandates for all healthcare workers. But many of these workers are across the country protesting these requirements. And look, there is an argument to be made. If you try to force it, you will create an emboldened resistance. So let's discuss with the president of the National Medical Association, Dr. Rachel Villanueva. Good to see you, Doc.
Nice to see you, Chris.
I'll tell people while we're both smiling at the end of the interview. The beginning, though, is this. Why aren't medical workers, who we would assume know the most, not getting vaccinated really that much more than the general population?
Well, I think what it tells us, it just reflects that healthcare workers really just reflect the nation. Not all healthcare workers, I think it's a misconception, but not all healthcare workers have a medical background or a science background. We have an extensive team that makes up our hospitals and our healthcare systems and that make them work. And many of these individuals have no medical background. So I think it just really reflects what is happening in our nation, that people have concerns, that people have been subjected to a lot of misinformation. And I think it's done us a big disservice.
Mandates, yes or no?
I think for healthcare workers, I think a mandate is necessary. I think that's why the National Medical Association, along with nearly 60 other representative healthcare organizations, signed on to this letter really asking healthcare systems and hospitals to mandate vaccinations, not only to protect our patients, which, those are our priority, our patients, but really to protect those healthcare workers as well and to protect their families. As you know, the National Medical Association represents Black physicians and patients across the country. And most of our patients represent underserved and under-resourced populations that have had low vaccination rates and so are at higher risk of severe disease, hospitalization, and death from COVID.
Now, it has also become a political football, is that when you hear people on the right fringe talking about who's not vaccinated, they'll say, well, they're mostly Black and brown minority populations who are in poorer areas. Now, we happen to know that the largest number of unvaccinated is 37% in the current read, and it's white Republicans. But when we do look at the reluctance and hesitancy within the Black community, which is very real and historic, what do you see and what is the remedy?
I see that that narrative has been played out a lot, I think, in the media. I think it really doesn't reflect what happens in our community, actually. I think in our community, when you have trusted messengers such as faith based organizations, community workers, your healthcare, your own doctor, many underrepresented minorities, many Black and Brown patients will actually accept the vaccine from those trusted messengers. So the National Medical Association was so pleased yesterday in the White House press briefing when the Biden administration announced that we would be partnering with some of our local doctors in underserved communities to increase vaccine acceptance and to get those vaccination rates up for our community.
Another question for you as a gynecologist. So we just got word from the CDC that all pregnant women should get the vaccine because of concerns with complications. Do you agree?
110%. I think today we were very happy to hear that our leading organizations, the American College of Obstetrics and Gynecology and the Society for Maternal Fetal Medicine, our high risk doctors, actually came out to support all pregnant women getting the vaccine. It took a long time for us to get that information. I think many local OBGYNs like myself were advocating for these vaccinations in pregnant women, knowing that they're at increased risk for severe disease, knowing that they're at increased risk for poor outcomes in their pregnancy. So we're just very happy that our governing bodies also agreed today. And so, well, I'll continue to do what I do every single day, which is to ask all patients, pregnant and non, are you vaccinated? If they say no, I discuss with them why, what their concerns are. I really listen to why they're concerned, and hopefully try to encourage, educate, and advocate for them to get vaccinated.
So, why the smiles? Dr. Villanueva and I have known each other our entire lives. We went to the same grade school, nowhere Catholic school in the middle of Queens.
Kindergarten.
Then I left to go to military school. We then wound up going to the same college. We went to Yale University, which like nobody from where we came from went to Yale. We both wound up going there.
Right.
And now Rachel is a
Right.
big shot, the head of the National Medical Association, and we live right across a bay from each other. She's in Mattituck, I'm in Sag Harbor. What are the chances? Anyway, Doc, I am so happy for all you've done with your life, your young life, and it's great to see you.
It's really great to see you too, Chris. Thanks for having me.
Thank you for making the world a more healthy place. I'll talk to you soon. We'll be right back.